What's up, beautiful people? Another day, another study. Vitamin C is a well known antioxidant, but it also serves as a neuromodulator and a cofactor for many biological processes. Now, up to 45% of the US population has inadequate intake of vitamin C. The RDA is 90 milligrams for men, 75 milligrams for women. And this is not surprising given that only about 14% of Americans eat enough fruits, about 12% eat enough vegetables, which are foods that are high in vitamin C. If you look at outright deficiency, about 7.1% overall meet the criteria for vitamin C deficiency, and that can be up to 30% in some subpopulations like those who smoke, right? And that makes sense because smoking causes inflammation, which is going to cause the body to use up antioxidants like vitamin C. There's also probably some dietary links there that people who smoke probably have worse lifestyle habits. So anyway, a previous observational study found that higher vitamin C intake was associated with 18% lower relative risk of Alzheimer's disease. Few studies have examined the association between vitamin C and brain structure. This study looked at vitamin C levels and default network mode connectivity. The default network mode is responsible for things like future thinking, self-reference, attention, and they looked at global and regional brain volumes as well. So over 2,000 adults were in this study, mostly around 70 years old, and then 61% women. All participants had plasma vitamin C levels measured and underwent a MRI. People with lower vitamin C levels had less gray matter in their brains relative to their overall head size and weaker connections in the default mode network. These findings held up even after the researchers accounted for other factors such as age, sex, diabetes, cholesterol, education, alcohol, physical activity. Now, the effect sizes were small, but in line with those of other nutritional and lifestyle factors when those studies looked at these factors and the impact on the brain as far as structure goes. Now, this isn't a outcome study, it's observational. It used data from another study. It's not generalizable to the US population. There's self-reported medical history and lifestyle factors. But given that one of my key things that I try to do with patients is get them to intake more fruits and vegetables, more fiber, and knowing that vitamin C inadequacy is fairly common, it's an intervention that I do discuss routinely with patients to make sure they're getting enough of this key antioxidant and neuromodulator and cofactor.